Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. This is number 74. I'm Steve Triffletti, your Plymouth Town Moderator, and we'll be here each week to come before you to provide this update. Today, our guests include Ken Tavares, Chair of the Plymouth Select Board, Dr. Philip Triffletti, Dr. Barry Potvin, Dr. Christopher Campbell, Stephen Cole, and State Representative Matthew Muratore. This is coming to you live from PAC TV. You can send your questions to info@pactv.org, and you can watch this live on Comcast and Verizon. At this time, we're going to begin with the Chair of the Plymouth Select Board, Ken Tavares. Ken, welcome.
Thank you, Steve, and good afternoon to everyone and then to the panel also. Today, I only want to take a couple of minutes. I want to share something very personal with you. Since March, we've all worked, I think, extremely hard, making people aware of the COVID virus, what it can do, ways that we can try to stop it, and take care of our community. And I think we've had many great successes. And every day, sometime between 5 and 7 o'clock, sometimes 9 o'clock in the evening, we receive the numbers of people that have tested positive and those that may have passed. And I actually kind of dread the late evening hours, knowing that there are going to be more, especially in the last couple of weeks, than we had expected to see. One day last week there were 17, other days have been 11, 9, and all in various age brackets. But I think what shocked me the most was being very aware of these figures, was now I know some of the people. And that has made a tremendous impact on our household. It's one thing to say, okay, there have been 17 people impacted. There have been, there is one death when you don't know the people, but it's become very, very personal. So I want to say that I don't think that any of us can offer apologies for trying to take stricter measures to prevent the spread of this virus. We know that with the Thanksgiving holiday coming up next week, that the 2 weeks after the holiday are going to be telltale as far as how we behaved ourselves and what we did to prevent it. But now we're looking at, and at least in our household, we're looking at people's faces, and that is really disturbing. And I'm just asking you, please, stop and think about what you're doing. Putting the mask on, it is a nuisance. There's no two ways about it. When I keep one near my front door, as soon as I hear the doorbell, I go for the latch on the door when I really need to get to the mask first. When you're just walking on the streets wearing a mask, it sometimes seems silly, but all of this adds up. And we need to do it. We need to follow the direction of our national leaders that are saying mask, hands, distance. Please, now I'm sure that you have all experienced the same thing. These are people, these are our neighbors, these are our family members, these are our friends. And it is shocking to see how fast this is spreading. Please follow the guidelines that have been spelled out for us. It doesn't take much on our part to do it, but it is absolutely necessary. Thank you.
Thank you, and that is Kenneth Tavares. He is Chair of the Plymouth Select Board. He and the other members of our panel are available to answer your questions. Send them to plymouthinfo@pactv.org. And now we welcome back Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. And Phil, since your last time with us, a lot has happened, particularly with vaccines. What do you have for us today?
Thanks again for having me today, Steve. And reflecting on Ken's opening comments, certainly it is sobering And the difficult news in today's message is, yes, we're seeing a lot of spread of the virus, and I'll talk a little bit about that. But I also do want to point out that there's also some great news with the vaccines, as you pointed out, Steve, and we'll go into that in some great details. Great breaking news even this morning about the improved effectiveness and results coming on the Pfizer vaccine. So we're going to be in a position, it's going to take some time, several months. I think we don't really know what the timeline will be, but we will get those vaccines. People will be able to get them, and I do believe we'll be able to stop this pandemic in its tracks. So it's just going to take a little bit more time, and we're going to have to continue to do all the things we know we should be doing in the meantime. So let's just talk about the tough news first. I'm going to really just talk a little bit globally and nationally, but I was looking at the statistics yesterday for what's happening in the world, and right now we're having about 500,000, or that's 500,000 new infections per day in the globe, and a lot of that, of course, is driven here in the United States, where in the United States we're seeing about 170,000 new infections per day. So those are staggering numbers to see how much it's spreading. Right now, if you look at the curve online, you can just see it's really gone up a lot from the spring and the summer. It's just really cresting, and there's no end in sight yet. So there's a lot of work to do to really stop this from spreading further. Some of the data from other parts of the country, like South Dakota, it's stunning to me, but they're now seeing positivity rates on testing that are approaching 60%. 60% of the people going for tests are turning back positive. So they're just seeing, again, staggering numbers of people being infected in their communities. So we have to really, really buckle down. Everybody has to be working on this together. I'm going to leave a lot of the explanation of what's happening in Massachusetts and also in Plymouth to other participants, but it's clear the numbers are going up, and as people I'm sure know, the hospitalization rates are going to follow the rising infection rates by several weeks, and the actual deaths from this surge will follow probably by a couple months. So, we haven't reached a plateau yet. We don't know where that's going to plateau out, but we're going to be in for some bad news in the next few months, I think, in terms of both hospitalizations and deaths. So we have to be prepared for that. And again, be very careful about, how we conduct our daily lives individually and collectively in our communities. I did want to mention one study that I came across in the last week. I thought it was very interesting, just showing how hard it is to find the virus. There was a study published by the Marine Corps. It was published in the New England Journal of Medicine, and it basically showed that when they did extensive testing and quarantining of recruits, they still had about 1 or 2% of their recruits that they got into their training situations and were positive. So it just goes to show how sneaky this virus is, that if you do all the things that you would think would prevent the spread and trying to create a bubble, it's even hard to create a bubble that doesn't that nobody can break into. And so that's why we have to do all these things that we've talked about with masks, social distancing, et cetera, and testing to try to avoid spread. On the issue of masks, I think we can't emphasize enough how important masks are. And I keep seeing more research data that shows how effective masks are. Sometimes it'll say, 70% effective. I think in some studies, really over 90% effective. There seems to be a huge benefit to wearing masks. And, universal masking, I think, has an incredible impact on how this spreads. I think one of the reasons we've done better in the Northeast, obviously, over the last several months compared to other parts of the country is because of how adherent people are here to masking. I think there were some studies done last spring that showed that we were about 80% adherent. That actually number seems a little low compared to what you might see on the streets. But I think compared to other parts of the country, we were doing much, much better. And we want to continue to do that. When you look at what happens to situations where people don't wear masks, you could have one infected person could infect several hundred people over the course of a month when people aren't using masks, versus if everybody was being very conscientious about masks, one infected person might only infect another 1 or 2 people. So it has dramatic effects on the spread. One of the things I've been delighted and frankly surprised is how well the public school systems have done. Why are they doing so well? I believe is mostly due to universal masking. I'm sure they're doing a lot of social distancing as well. But the data from the state on how many students have been infected and how many staff members have been infected, very low numbers, only in the hundreds versus the thousands and thousands of students and staff members statewide that have been participating in schooling face to face. So, I think, we know the masking works. We have to do that. I think it's worth pointing out, of course, with the Thanksgiving holiday, how important it is. We know from a lot of data now from our state and elsewhere around the country that a lot of problems are happening because people have gatherings, private gatherings in homes. They don't wear their masks. There's this new term, I think, called an expanded social bubble. And so that people are, they're letting their guards down, so to speak. They're allowing, more family and friends into their homes without masks, and that this is, contributing to more spread. And so, right now, until that vaccine is out there, and that could be 6 to 12 months before we get, most of the country immunized, we really have to, double down and try to avoid the temptation to expand your social bubble. I like what Mayor Walsh had to say, I think it was yesterday, that, when you're planning your Thanksgiving plans, just have it be your immediate family. Don't have it be any extended family. And that's certainly what we're going to do at our household. We're only going to have 6 people in our house for Thanksgiving. Sorry, Steve. I know you wanted to come. Anyways, keep up your guards. Keep trying to work on keeping your gathering sizes small. Wearing masks. Can't emphasize it enough. Let's talk about the vaccines. I mean, over the last couple of weeks, we were breaking the news, first about the Pfizer vaccine, and then in the last 2 weeks, now we have the Moderna vaccine. They're both reported to be about 95% effective. Pfizer came out this morning, released some more data, and said that this vaccine is also safe and effective, not only in younger individuals in middle age, but also in older age groups. So all age groups responded very strong, 94% effective in over age 65. It was effective regardless of race, regardless of gender. So it looks like, we're going to have a tremendous opportunity here to, curtail this pandemic with the vaccines. And it's extremely encouraging. What we don't know yet about the vaccine, nobody knows, how long will the protection last? Many months ago, I've heard Dr. Fauci talk about this, and I think, he's hopeful that it could be 1.5 years, 2 years. Nobody knows the answer yet, but, we're hopeful that the vaccine will last a significant amount of time. So it's looking great. We still don't know from some of this early reports from the manufacturers about the vaccine. We know it prevents people from getting symptoms, which is very important, by that 95%. It also reduces hospitalization rates also by about 90% from people getting severe illness. So those are 2 very important categories. We just don't know yet how much it's going to be reducing asymptomatic spread. So that'll be more information to come on that. But, it looks extremely promising. As I've said before, I thought the government did a great job, investing in vaccines last spring. They've invested about $10 billion for these companies to start producing and stockpiling vaccine, even though it's not approved yet. And the latest numbers that I've been seeing is that Moderna now is believed to have about 50 million doses ready to go. Pfizer also is believed to have about 50 million doses ready to go. So each of those would allow us to immunize, about 25 million each or 50 million people out of, say, 350 million people in the United States. So that's just the initial vaccine inventory, and it's believed that later in the year from Pfizer that they are going to have 1.3 billion doses, of which about half of it is going to be purchased by the United States. So that'll be well over 500,000 doses available. So we're going to 1.3 billion, math, I meant 500 million, over 500 million doses available. So we're going to have probably huge amounts of supply. And again, I think one of the most trusted voices here with the leadership on this issue with the pandemic is Dr. Fauci. And, he seems very confident that by the second or third quarter, a good portion of the United States will have a chance to be vaccinated. Now, I think this is a good opportunity just to say, surveys are showing only about 50% of people are excited about getting the vaccine. And this is very similar to what a typical flu season last year, only 50% of people took the flu shots. Not everybody is eager to take a shot, but I think, like Ken was saying, today, this is a serious thing. It affects people that people get seriously ill, people die from this. We really want to encourage people, once that vaccine is available, just, I think it's not too early to really start to solicit people and say, when that vaccine is there, you really should take advantage of it to protect yourself, protect your family and friends around you. But, we're really getting very close. I did see one report from a state official, and I'd love to hear if Matt has any further updates on this about how well prepared the state of Massachusetts is to distribute the vaccine once it's received. And, I think people are hesitant to give timelines, but I do think it will be a challenge. And hopefully, the preparations are well underway so that, once the vaccine is available, we can get it out to the communities and get it to the people who need it. So that's what I wanted to start with. But again, numbers are going up. We have to do all the right things, wear the masks. I think avoid indoors without masks, avoid, social gatherings without masks, try to keep gathering sizes small, holiday celebrations small, do all those right things. And I think we'll be able to bend the curve here in our communities and in Massachusetts while we're waiting for the vaccine. So be happy to take questions later, and I'll have a few more comments. And thanks again, Steve, for having me today.
Thank you, and that's Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Please send your questions to PlymouthInfo@pactv.org. And Phil, thank you. We'll miss not joining 20 and 30 people that you normally host, but we'll be also doing 4 for the main course and 4 for dessert. So we know we have a responsibility to our immediate family, also to our business family, and to the greater community here in Plymouth. So thank you for your comments. And at this time, we're going to continue with our medical segment. We're going to go to Dr. Barry Potvin. He is the chair of the Plymouth Board of Health. Welcome, Barry.
Thank you, Steve. So I have an awful lot of stuff I could cover, but I'm going to restrict it as much as I can so it wouldn't take too long. There'll be a lot more discussion going on at our next Board of Health meeting, which is scheduled for this coming Monday from 4 to 6 p.m. Probably about at least an hour to an hour and a half of discussions about the coronavirus and COVID-19. We'll be covering things like long-term effects of the COVID-19 infections, which hasn't gotten a lot of press, emotional and mental health problems among school children under these conditions, and some information about the Binax Abbott rapid antigen test, which apparently is going to be dispersed quite widely and apparently is going to be pretty effective. So the things I'm going to talk about today, first is an update about the COVID-19 statistics. I know this steals some of the stuff from Matt, but he usually just crosses it off his list as I do it. Among the things that you probably should know is that in the United States, there's currently about 11.2 million cases of the COVID-19 disease. And there's been about 246,879 deaths, which is an astounding kind of number to even get a grip on. Those numbers, respectively, in the past 14 days have gone up 82% and 40%. So this is really incredible. It also has been published that there have been about 1 million new cases in just a week, whereas the first million cases back in the spring took about 3 months to occur. So kind of takes your breath away. In Massachusetts, there's been about 186,774 cases and 10,130 deaths. And the latest data from town of Plymouth is that there are 1,044 known cases since the start of the pandemic and 92 deaths. So unfortunately, we are in the process of adding more chairs to our empty chair memorial display in front of Town Hall. The 7-day positive test rate, which is published by the Massachusetts Department of Public Health, started off for a long time at 0.8%, which was quite low. And now it's gone up to 3.2%, so it's gone up 4 times. And if they take out the people who are being repeatedly tested in colleges and universities, it's actually more like 5.3%. So again, it's kind of takes you back a little bit. Face masks are being emphasized a lot. There's been some new studies that came out that indicated that generally speaking, 95% of the viruses that you actually get are usually coming in through your nose. And face masks, if they have at least 2 layers of cloth in them, are generally thought to drastically reduce the virus load to the extent that while you may inhale some viruses through the masks, they're going to be in such small numbers that they may not cause serious illness and may not cause symptoms at all. So that's a couple of things from statistics. We're obviously well into the large increase in positive cases that everyone had been afraid of. There has been a steady, slow increase in hospitalizations that have been going on, but at least here in Massachusetts, the numbers are still well below what happened last spring. And the hospitals are much better equipped and prepared for this now. The treatments have been changed, and they now are trying to avoid as much as possible putting people onto mechanical ventilators, and they pretty much have succeeded. And they're using oxygen therapy and a lot of other things that they've learned from their past experiences. In terms of what's happening in Plymouth, we're still yellow. We have been for the past 2 weeks now, and we're only yellow because they changed the matrix that they used to calculate this with. Our numbers have still gone pretty much way up. It looks like this coming Friday or Thursday late, when the numbers come out again, we likely will still be yellow. We could be red. It depends on a couple of different factors. But in terms of the 14-day average positive test rate, which used to be a cutoff of 8, it's now 10. And the worst we've ever seen here in Plymouth was a 12.8 positive to daily average test rate. That happened about the middle of October. It's probably going to be at least that high again, if not somewhat higher, when the numbers come out tomorrow or Friday. So we're hoping that this is going to slow down some, but we're still in the midst of it, and we have to be very, very cautious and not let our guard down. Vaccine information, just to add on to things that Dr. Triffletti was talking about, there's a huge logistical challenge in trying to get these vaccines distributed. When you hear about all the doses available, you have to remember 2 things. One is it's not just for this country, it's worldwide demand. And so some of it won't be given out here in the United States, but will be distributed elsewhere. Also, these vaccines require 2 doses. And so at least in the case of the Pfizer and the Moderna vaccines, you have to get a second shot about 4, maybe 3 to 5 weeks after the first shot. And it must be the same vaccine. You can't mix and match. And so this is a logistical challenge, not only in getting the vaccines distributed, but just maintaining all the information you have to make sure you reserve enough of the specific vaccines for the second dose for those that already had the first dose, and that they can get it when they need to 4 weeks or so after the first shot. So that's going to be difficult. I was a little bit concerned when I was listening to the webinar for local boards of health yesterday, when I heard them talking about, well, the plans for distributing the vaccine are underway, but we're obviously going to be depending upon boards of health to set up large vaccination clinics. And I looked at that and I said, oh, really? That takes a lot of planning. And we're obviously going to have a lot of discussions about exactly how we're going to do this in cooperation with the state. We currently don't have anybody that I know of that's capable of or licensed to give vaccinations on the Board of Health or the Department of Public Health. So we're obviously going to have to depend upon other people for this. Another problem is the vaccines have to be stored cold. And when I say cold, I mean really cold. So the Pfizer vaccine has to be stored at a minus 70 degrees centigrade temperature. There are very few freezers that are capable of that outside of research institutions, medical schools, and probably some biotech companies that have freezers that can accommodate that kind of temperature storage. So they're going to depend on dry ice instead. Well, that's good, except dry ice supplies are probably going to be very limited as well. The Moderna vaccine doesn't have to be stored as cold. It seems to be somewhat more stable. So that's going to be a big advantage for using the Moderna vaccine. And Johnson & Johnson, in cooperation with BID Leahy, has developed another vaccine which is entering its final testing stages, which is yet probably going to be even more easy to use because it may only require one shot. Again, as Dr. Triffletti said, we really don't know how long the protection from these things is going to last, but certainly it's going to be a big step forward. Everyone says to get control over this, we're probably going to have to get about 50% of the population vaccinated. And in terms of how long it's going to take, probably end of December, early January, they'll be giving it out to medical care facilities to give to their workers. Also to, I assume, nursing homes and congregate living facilities. Those people are on the front lines and they need protection as fast as possible. Then it would go to people with pre-existing conditions and some of the elderly people. And eventually in phase 3 and phase 4, probably in April to June, it'll be made more widely available. And again, it's going to be thousands of people. You think about, well, 60,000 people here in Plymouth. We have to get at least 30,000 of them vaccinated. You imagine 30,000 people trying to get vaccinated within a couple of months here in Plymouth, and the kind of challenge that's going to present to us. Finally, some more things about Thanksgiving. First of all, the good news for Thanksgiving is that Zoom has decided that they're going to grant unlimited access to Zoom, even for those that haven't paid for the monthly extra fee for the premium service on Thanksgiving Day. So they won't cut you off after 40 minutes. You can talk as long as you want with your relatives and friends. You can toast Thanksgiving with your relatives and friends remotely via Zoom. It's not as great as being with them in person, but it's probably it is a lot safer, and there's no time limit anymore. As was already mentioned, you really need to confine your Thanksgiving celebrations as much as you can to members of your own household. And that means there's even a problem when you bring in family members that are not residing with you in the same home. So if you look at some of the statistics that they've published on maps, you notice in Plymouth, it's estimated that if you have a family gathering of 10 people, then there's about an 8% risk that at least one of those people will be carrying the virus, and they may be asymptomatic, pre-symptomatic, and not even know they have it. Obviously, you'll be eating and drinking, you won't be wearing masks, and this could spread easily to other people at your holiday celebration. If there's 25 people, then the risk goes up to about 20% here in Plymouth. And it varies from place to place. So what can you do? Well, it's worrisome because in Canada, they had their Thanksgiving before us, and about 2 to 3 weeks later, they had a huge spike in cases. So it's something that's happened before. We should learn from the past, or we're condemned to repeat it. We don't want to repeat this. It could damage our schools, it could damage our economy, and it could lead to a lot more deaths. So we have to be very, very cautious about this. If you're going to have a family gathering, there are things you can do to make it a little less risky. You can do it outside or with open windows. Easier said than done when it's in the 20s. You can wear masks at all times, and that means for everybody except when they're not eating. When they're eating and drinking, they wouldn't obviously be able to. You can separate tables. So if you have a lot of people and you can't keep them 6 feet apart at the tables, you can set up multiple tables. You can't have buffets because people get too close together in order to fill their plates. So they recommend that 1 or 2 people in the kitchen just make individual plates and then bring them to the tables. There's a risk in terms of college students returning home for the holidays. because again, although they've been tested a lot, there's no guarantees that they won't be bringing the virus with them. And there's no guarantees after Thanksgiving celebration that they won't take the virus back with them when they return to college. So a lot of things to think about. You have to consider all these risks. I know a lot of people are going to insist that they have to celebrate Thanksgiving, but just remember, this is 1 year. By next year at this time, we should have most of the population vaccinated, and hopefully everything will return to pretty much normal. So I'm going to stop there. I took more time than I wanted, but there was an awful lot of things to talk about. So I'll be happy to answer any questions at this time for afterwards. Thank you, Steve.
Thank you, Dr. Barry Potvin. He is a professor emeritus at Yeshiva University, Department of Biology, epidemiologist. You can send your questions to PlymouthInfo@pactv.org. And now we go to our education segment. We welcome back the Superintendent of Plymouth Public Schools, Dr. Christopher Campbell. Welcome, Chris.
Thanks again for having me, Steve. First, I'd just like to highlight the school COVID information from this past week. So last week we had 8 students newly reported with positive COVID cases. We have 36 students that are under quarantine from last week. 3 of our staff with newly reported COVID cases and 6 under quarantine. So this past week, as we've all heard, has been a large spike for us. This past week, we've witnessed our largest number of students and staff confirmed cases in the 8 weeks that we've tracked it. I'm happy this week seems to be on a better trajectory than the past week, though. Having said all that, I continue to be encouraged by our practices in schools. I really need to stress that. The fact that we continue to see no transmission, no confirmed transmission within our schools, I think it really speaks to the vigilance and the excellent work that our staff, our students, and our families are doing to support our practices within the schools, maintaining physical distancing, wearing masks, hand hygiene. Everything that we're doing seems to be working in our schools. We're not seeing transmission in our schools, which is really good. I also want to highlight a few other things for your viewers: the update on Department of Public Health metrics, the updated guidance from the Department of Education, and communications that we'll be sending out tomorrow prior to our Thanksgiving break. So as Dr. Potvin has already referenced, with the November 6th update by the Department of Public Health to that weekly color-coded designation for communities in our Commonwealth, the Department of Education has issued updated guidance on interpreting the metrics for school settings, which replaces the previous health metric guidance that was issued August 11th. The Department of Ed has made updates to its initial guidance on interpreting these metrics, even as we've seen an uptick in COVID cases statewide. As I've said, with our strong health and safety protocols, districts have demonstrated that they're able to operate safely for in-person learning, Plymouth included. As I mentioned, the Department of Ed has updated this guidance, and there are 4 specific points to consider for these updates. First, districts are expected to prioritize in-person learning, across all color-coded categories, unless there is a suspected in-school transmission. So that's important to note, and we're not seeing that, as other districts aren't. Districts in schools and communities designated as gray, green, or yellow are expected to have learning fully in person, if feasible, and I'll talk about that a little bit in a moment. But schools in red communities should implement hybrid models while maximizing in-person learning for high-needs students, and fully remote instruction models should be implemented only as a last resort. Now, people have inquired with me and some of our administrators about when we should return fully, given the new metric. As soon as that information came out, we received a lot of questions about that. So while I think it's a bit premature right now to make that transition, we do continue to evaluate what it would take and how we would manage that transition when the time is right. We have just completed the administration of 3 surveys in our school district for students, staff, and families, and we're in the process of synthesizing feedback from literally thousands of stakeholder surveys from our students or staff and family members, like I said. And I hope that through this and the transit, as we, in the interim, that we can find creative solutions to engage our students even more, even when they're not able to physically join us in our classroom. So we're continuing to do that regardless of the model. It's really important to us. It's important for the public to know, though, that we would not be able to fully return unless we see some revisions to our transportation restrictions that are set forth by the Department of Education. So right now, as many people know, we are currently restricted to 1/3 capacity on our buses, with nearly 70 buses running 3 times in the morning and 3 times in the afternoon. As this community knows, we're a large community. I think we have one of the largest bus contracts in the state, with over 104 square miles to cover, and it takes a lot of buses. So when we're at 1/3 capacity, that is definitely a challenge, regardless of the COVID situation that we're dealing with. So we are limited right now with bus availability and the significant cost to expanding bus usage. So we just don't have the fleet nor the funds to do something under those restrictions. But it is my understanding that if metrics would continue to improve, that we may see over time some revisions to that. So as I said, in the interim, we continue to look for ways to increasingly engage our students and support them even from home when possible. Related to communications, tomorrow we'll be electronically distributing and promoting additional health and safety information to our staff and families. We will be promoting an informational flyer highlighting all you need to know about prevention and managing COVID. In this publication, we'll also be including our health services COVID prevention video series, which we did a few weeks back. We're reintroducing our Keeping Our School Communities Safe, where we have 3 videos that we've produced in collaboration with our health educators, promoting, again, primary prevention strategies, secondary prevention strategies, contact tracing, just really informing our school community what they need to do, and getting another update from our health educators. So other information that will be in this publication includes what you need to know about isolation in dealing with positive COVID situations. So we've, with the number of quarantines, we've really had to work very closely with our families and our staff to have them understand what it takes to mitigate and what it means to quarantine. So really educating people about that, what is considered a close contact, and what you need to know about quarantine if you are a close contact of a COVID positive individual. So lastly, what we will be sending out for publication is regarding travel. So as we've talked about, Thanksgiving break is coming up. We hope everyone has a wonderful Thanksgiving and can celebrate with their families in a safe and responsible way. But with the upcoming holidays, we really want our staff and families to take note of the guidance for travelers arriving in the Commonwealth of Massachusetts. So mass.gov has great resources there. We just really want people to look at this information and understand what their responsibility is if they are traveling during the break. And again, we really want people to stay close, to be smart and safe, but just really getting people to understand what their responsibilities are if they do find themselves traveling. So in closing, I just want to thank, at this time, just thank our entire community for the support, their flexibility and their understanding. This has been a year that has not been easy on anyone, but I truly greatly appreciate and I'm personally thankful for the overwhelming support that our school community has shown, and just want to wish everyone a happy and safe Thanksgiving. We hope that we don't see a large spike in cases after Thanksgiving week. It's really important that we have safe, healthy Thanksgiving so that we can keep our schools open and keep our students in school. So thank you, Steve.
Thank you, Dr. Christopher Campbell. He is Superintendent, Plymouth Public Schools. You can send your questions to him at plymouthinfo@pactv.org. And that completes our education segment. We move on to our business segment. We welcome back once again Stephen Cole. He's the Executive Director, Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hi, Steve. Glad to be back. Thanks for having me. Hello, panelists. To those folks at home, let's jump into another installment of 60 Seconds of Stephen, okay? Unemployment rate in town is actually down yet again to 6.6% the last time I came to visit. we were talking at 7.1%. So for 21 straight weeks, we've been trending in the right direction. That is positive, but I want to remind folks that we still have some progress to make. We were at 2.8% prior to COVID. We did, though, have a high unemployment rate through from April, May, and June of 18.5%. So we've made great strides since the lowest of the darkest of the days. To help move the recovery along, some folks at home may already know about the governor's $774 million economic development recovery plan that focuses on workforce development, small business assistance, downtown revitalization, housing, and innovation. I'm expecting more information to come out about how we can access those funds if necessary and applicable to us. And of course, we are seeing some positive trends on the horizon that kind of demonstrate that we're hedging toward a recovery. But I really do want to caution, of course, everything that Barry and Phil have said, that we still have a long way to go, and just kind of put a stamp of data on some of these trends that I'm seeing here. The MBTA, which is dominating a lot of the conversation in town these days, they've been gaining about 30,000 riders per month since April. April was the deepest of ridership for them. Their normal ridership, though, was about 1.2 million people a day, and they were doing that in January. They're right now up to 326,000 riders a day. So although they've been gaining riders each month to the tune of about 30,000, they're still at a fraction of where their normal operating ridership is. Some other encouraging news, though, that I'm seeing is that Business Insider released an article a couple of days ago, perhaps a week ago, that said that Americans are sitting on $2.5 trillion in personal savings. That's the highest that we've seen in better than 2 generations. So those folks who are disproportionately and more less negatively affected seem to have developed a little bit of a savings. My sense is that, of course, once we're able to move around again, you'll be seeing people using that savings to do so. Overseas travel is still down 95%, but the volume of travel is still 10 times higher than it was in April. September was 44% higher than it was in August. So although we still have to get through winter and we have to remain vigilant, some of these things are giving us some positive sentiments. One thing is certain is that recovery will be slow in some places, and when things reopen, there will be fewer options for people to go. And so one of the things that we're working at the Recovery Task Force and here at the Foundation is to position Plymouth in a way so that when people are able to travel again, they think of Plymouth. They know that Plymouth takes this seriously, that we've done all the things that we need to do to make sure that their safety is accounted for. And I'm very proud to announce that the Plymouth Recovery Task Force, with funding from the Foundation, is launching what we're calling the COVID Ready program. Because frankly, good health is good economics. This is largely intended to communicate to folks who are visiting town that the businesses and the places that they visit here in town, we're ready. We have done all of the things that are considered best practices or industry best standards to ensure that their safety is taken into consideration. On the back, you'll see that there's a checklist that shows folks what these businesses are doing. That includes things like signage requiring masks, hand sanitizer being provided. Business policies ensure that there's at least 6 feet of separation, including distance markers on the floor. Some shops have limited number of visitors inside so that they can ensure that these things are met. And this is a volunteer-based program that's business-led. This is not a regulatory initiative by any government. These are small businesses who have come together and decided that we need to do something in Plymouth that distinguishes ourselves from other coastal communities in New England. So while it's important that we remain vigilant, the purpose for this program is for small businesses to communicate in a very public, forward-facing way that people should feel comfortable going into that store, because that store or that restaurant is doing everything that they can and should be doing to ensure that you're having a safe experience. So I'll pause there for a moment. I'll just let folks know that if you are a small business owner or if you work at a small business that you think could benefit from having a program or having the decal program, please let us know. Reach out to either myself or Amy Naples at the Chamber of Commerce. These are free to participants. And thank you, Steve, for the opportunity to present this to folks today.
Thank you, Stephen Cole, Executive Director of Plymouth Regional Economic Development Foundation. We're now going to go to one of our regular guests that's been here with us throughout the 74 programs, Plymouth State Representative Matthew Muratore. Matt, we started in March. We're in our 9th month. You still have more for us today.
Yeah, and unfortunately, I think we will be probably going until next March, at least, if not longer, doing these shows. But with all the doom and gloom that we're hearing here today, there are some bright spots. We are seeing in Massachusetts the hospitalization rates. Yes, they're going up, but they're nowhere near where they were back in April. When you look at the number of folks that are in the hospitals in the Commonwealth right now, it's 835 with the average age of 67. The average age of 67 was the same average age back in April and May. But the folks that were in the hospital back then were 3,892. Right here in BID, Plymouth, we had back on April 28th, 46 patients with confirmed cases of COVID and 9 in the ICU. And right now, throughout the Commonwealth, we have 159 COVID patients in ICUs with 73 vented. So I think my point is that we have learned a lot in the hospital community, in the healthcare community. We know how to handle surges in hospital capacity. So we have more than 50% hospital capacity on the South Shore for ICU beds at this point. You heard last week the governor has announced that the Worcester DCU Center will open up again in the next couple of weeks as another COVID site. So we are much better prepared this time around. We are in the surge at this point. The average age, though, and this is what's different than it was the last time. When you start looking at the average age now, we look at the average age over a 2-week period, looking at October 25th to November 7th. The average age of COVID positives tests is 38, whereas back in the end of April, it was well into the high 70s, low 80s that people were getting this. So it is shifting, and it's shifting to people who aren't as sick as they were back then. It's still those that are dying, 98% of those have some underlying health conditions. In that 2-week period that I talked about, anyone age 60 plus, there were 3,231 COVID cases reported from October 25th to November 7th, compared to ages 0 to 19, where it's 3,600. 20 to 29-year-olds were 4,300, and 30 to 39-year-olds were 3,500. So you can see, where that trend is going. That's 11,352 people under the age of 40 that have contracted the COVID virus in the 2-week period, compared to those over 60, which is 3,231. So wearing the mask, does make the difference. We do see the vaccines on the horizon. I know both Dr. Triffletti and Dr. Potvin did talk about that. What we do know, though, is so far the initial batch the federal government has purchased. So the federal government will be taking the initial batch that will be coming out shortly and dealing with that. But the state does have plans in place of how they're going to distribute that. And I think, Barry, it will be more than just relying on just public health local departments to do that. I think there'll be other places that people will be able to get this as well. So there'll be more of a detailed plan coming out on that. Right now in the Commonwealth, there are 32,300 active cases of COVID. The 7-day average positivity cases is 3.25% in the Commonwealth. There are, at this point, we did hit the 10,000 mark. Steve, I think I mentioned that last week, that by this show, we would hit 10,000 deaths. We're at 10,130 confirmed deaths with the average age of 80 years old. And 64% of those deaths, 6,600 deaths, have actually come from long-term care facilities. In Plymouth County, we are at cumulative cases since this all started of 13,146 with 874 cases, 874 deaths in the Commonwealth, in Plymouth County, sorry. Also, I did want to just touch upon briefly, I know both physicians talked about this, but the travel for Thanksgiving and travel over the holidays is obviously an issue. I would encourage people to go to mass.gov/Thanksgiving 2020, and you can get all the details on that. And you also want to look at the travel. A lot of colleges will be leaving. The governor has just come out and is requiring all colleges to actually vaccinate every student before they, not vaccinate, to give a COVID test before they leave, 72 hours before they leave to go wherever they're going around the country or the world to make sure that they have that. If students are coming back after the holiday, again, the travel restrictions are still in place. A test 72 hours prior to coming, needing to be negative before coming back would have to be in place. Otherwise, it's a 14-day quarantine. So I would encourage people to go to the mass.gov COVID website. There's a lot of information on there that can help with travel and to help you with understanding what to do for Thanksgiving holiday. And the last thing, I was watching, the governor was on while we started the show today at noontime. So I was watching some of the things that he was talking about. And Commissioner Raleigh brought up that they're looking at testing in elementary schools in the Commonwealth that will be coming up in December. There's 135 school districts that are looking to do this. So more details will be coming out, because the goal will be to get students to stay in school, but get more and more students back into the school. The more control settings we have, the better off for the spread to be reduced. What's happening now is from a period of almost a month, October 11th to November 7th, there were 13,178 confirmed cases, of which 11,268 were from homes. These are people that were at home, that were at gatherings at home. Let me just repeat that again. Out of the 13,178 cases in a 1 month period, 11,268 cases came from people's homes. The next largest group was 518 from long-term care facilities. That's a big drop. So you can see the more you're in a controlled space, the better off you are, which is why the schools are looking to get more and more kids back into the school system. So I just want to be sure folks had that information. Again, can't stress enough, mass.gov/COVID-19 website. Check out the travel restrictions, check out Thanksgiving to help you out through these tough times. And that's the update today, Steve.
Thank you, Plymouth State Representative Matthew Muratore. We're now going to go back to our roundtable of panelists and ask them each a question and also hear their closing remarks. We're going to begin with Dr. Philip Triffletti. Dr. Phil, Lizette writes that her friend is pregnant and her obstetrician has advised that she should not have the COVID-19 vaccine. Do you have any circumstances when it would be advisable for one of your patients not to receive the vaccine?
That's a really excellent question, Steve. And I'm not a vaccine expert, but certainly, what I've heard about vaccine development is, as you know, they've tried to offer the vaccine in the initial trials to people of all age groups, gender and race, with the exception that, they have not started really researching this in children yet. And I think pregnant women is another high risk group. So I think they really want to see a lot more data from, the different adult age groups before they would venture into trials for children or for pregnant women. So I think that's very typical of vaccine development, that to look at these higher risk groups, they usually are more cautious.
And what's your takeaway today, Dr. Phil?
Well, I do want to talk briefly just about leadership issues. And, I think obviously having a new president-elect, I think is going to have a great influence on what happens in our country. He's put together a great COVID-19 advisory board. It's really stocked with, top physicians, scientists, healthcare administrators. So I think that's a very favorable change. Another thing that will probably happen, of course, with Joe Biden as president, he's going to engage with the World Health Organization. This is a global pandemic, and we're going to really need to work cooperatively with the rest of the world, not just getting the United States vaccinated, but, I think doing our part to try to make sure that globally we stamp out this pandemic. So I think that those are very exciting changes that will be coming from our leadership. I think our own individual responsibilities as leaders in our own community, I think I would challenge us all right now to think about, what are we going to do to try to really push those numbers north of that 50% acceptance rate for COVID-19 vaccine. I think it's not too early to really be campaigning and marketing for, people to be prepared. When the shot's available, they should take the shot. It's going to be safe. It's going to be effective. And there's no reason that people shouldn't be taking it. So we should be thinking about that. Think of creative ways. I think in the hospital systems, they're going to require us to take shots. I'm hoping that other institutions in the community, schools, businesses, I think people should think creatively about, how can we try to maximize the ability of this vaccine to stop the pandemic. So give that some thought. as we enjoy time with our families at Thanksgiving. Happy Thanksgiving to everyone.
Thank you, Dr. Philip Triffletti, attending primary care physician, Beth Israel Deaconess. We're going to go back to Dr. Barry Potvin. Barry, viewer Steve writes that he's been told that masks don't work. And he wants to know, you mentioned there are studies now that have indicated it reduces the virus. How can we help him with some references as to where to go to learn more about the studies that masks do work?
Well, the answer to that is obviously the sources have to be trustworthy. So if you look at anything that's being published by the CDC, if you listen to medical officials and doctors and epidemiologists, they'll all agree on one thing, and that is that masks are probably our most effective way, without getting into the vaccines, that we have to protect ourselves and each other. There is no doubt about it. There's no longer any question about that. There's a lot of hesitancy about it because, yes, they're a little uncomfortable, and there are people that were viewing it as a political statement. But this is life and death matters, and you really need to keep in mind that masks are critical, and it's widely accepted by the experts that there is no substitute for them. In terms of sort of final thoughts, I will be talking more about travel restrictions on Monday night, but keep in mind that Massachusetts feels that you don't have to quarantine or test when you come back from Maine, Vermont, New Hampshire, and Hawaii, but otherwise you do. But also keep in mind that except for New Hampshire, those 3 states require you to quarantine or have a test when you arrive. And so it pretty much restricts where you can go in terms of travel for the holidays. So the other thing, takeaway message, I guess, is remember when you're celebrating Thanksgiving, especially if you have school-age children with you or you have elderly adults present, grandparents that you certainly want to protect. Remember that anyone who is 11 years of age or older, and this includes an awful lot of the school-age children, they are going to be under the same restrictions in terms of testing when they return to Massachusetts or quarantining for 14 days when they return as anybody else. And this is vital for our schools. It's also, of course, vital that all the people who work in the school system realize the same thing. So if you're coming back from a high-risk state, which is almost all of them, you are going to be expected or required to take a test when you return before you can return to work, or you're going to have to quarantine for 14 days, which is going to put a lot of stress on our school systems. We can't afford to be losing that many staff and teachers from our school systems in order to keep everything operating the way it was before Thanksgiving. So it's just a matter of cautions, but you can still enjoy everything. My wife and I will be celebrating Thanksgiving completely by ourselves and just greeting other family members with the new Zoom with no time limit on Thanksgiving Day. And I hope that everybody stays safe and takes care of themselves and protects others as well. Thank you, Steve.
Thank you, Dr. Barry Potvin. He is chair of the Town of Plymouth Board of Health. We're now going back to the Superintendent of Plymouth Public Schools, Dr. Christopher Campbell. And Dr. Campbell, question from Karen, a viewer. What guidelines will the Plymouth Public Schools use to determine if schools need to close? And would you consider closing individual schools based versus a district-wide closure?
That's an excellent question. Thank you for that, viewer, for posing it. So there isn't one specific metric, because I should have mentioned this before. There's no one specific metric that would require us to close. It's really looking at a number of things. It may be the number of confirmed cases within the community. It could be, certainly would be a transmission within the school, but we would be looking at a number of factors, where the cases are arising. Is there any evidence of transmission within a school? So it's really looking at multiple data points, both as a school, as a community, as a school community, as a classroom. So in many cases, it could be very building specific. It could be classroom specific. It could be cohort specific. So we're always looking at that data. So while there isn't one specific metric, we're looking at multiple measures in terms of positive COVID cases. It also could depend on, as Dr. Potvin pointed out, our ability to keep our buildings staffed. If we have the need to quarantine individuals due to exposure to confirmed cases, this is really going to impact our ability to do our job and educate our students face to face. So we hope that that's not the case, and that people really do what they can to socially distance themselves in all situations so we don't find ourselves quarantining staff. But getting back to the question, there isn't one specific metric, but we would look at a number of things. First and foremost, the confirmed cases within the town, school community, and then also if there's any transmission within a school. Again, we are really prioritizing in-person learning as much as possible, and trying to avoid transmission within schools, which we have, and we continue to be vigilant about that.
Thank you, Dr. Christopher Campbell, Superintendent, Plymouth Public Schools. We're going to Stephen Cole. Steve, viewer Hazel writes, I'm no longer comfortable dining indoors. Are any of the local restaurants providing heaters for their outdoor dining or blankets?
Blankets is a new one. That's a good one. I have heard other communities doing that. We are working at the Recovery Task Force and coming up with some solutions to extend the outdoor heating season or the outdoor dining season. I mean, the best advice I can give folks is if you do not feel comfortable doing something, don't do it, period, full stop. Participate as comfortably as you can in the economy by doing things like going out to eat or going to visit our small retail stores. But barring some investment in heating lamps and some other things like propane tanks that I know draw some consternation from the fire department, we have some safety issues we have to concern ourselves with too. So be vigilant, keep your eyes open and ears open to see what restaurants are doing. In fact, I was just spending some of the time here looking at some fantastic places like what Uva is doing, as well as Mal Barberie is reopening. I think restaurants are going to try and solve this problem. And I think if you're interested in frequenting one of those establishments, just be mindful of what they're doing.
Thank you. Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. We're going to go back to our Plymouth State Representative, Matthew Muratore. And Matt, viewer Bob writes, the mass.gov dashboard used to report on how many COVID positive patients were in each individual hospital across the Commonwealth, but is now no longer reporting that. Will these numbers be shared again?
Probably not at this point, Steve, because as I mentioned earlier, when you look at the number of hospitalizations throughout the Commonwealth, there's 835 right now in the hospital. And we are very clear in the healthcare community that we're not going to go back to where we were back in, April and May and June, whereas, we were so overridden by COVID that we were telling other folks not to come for any care whatsoever, unless it was an emergency. It's pretty clear that there is surge capacity in the system for the amount of beds to handle the continued surge in this. I don't think we're thinking anywhere near we're going to get another 3,000 or 4,000 people in the hospitals at this point, because if you look at the average age, it's 38. It's not 80 as it used to be. So I'm not sure there's actually a need to see that. But on that website, though, it does give you the percentages of beds that are available by region. And which is why I give that on every report as well. In the Southeast region that we are in, there is 50% capacity in beds in the Southeast region for hospitals, and overall in the Commonwealth, it's the same number as well. So I think that really covers it, Steve.
Thank you.
I just remind people too that everything we're hearing today is about controlling COVID, and as Dr. Phil has said in the past, that the more we can control COVID, it's good for our health, it's good for our economy, and it's good for the schools. So let's continue heeding the advice from the professionals by wearing masks, social distance, et cetera, and we will get through this.
Thank you. Plymouth State Representative Matthew Muratore on our panel with Dr. Philip Triffletti, Dr. Barry Potvin, Dr. Christopher Campbell, Stephen Cole. We now return back to the chair of the Plymouth Select Board, Kenneth Tavares. Ken, you began this segment with some concerns. And one of the things we've tried throughout the past 9 months is to provide trusted sources, reliable information, experts, officials in elected office. You are the chair of the Select Board. If people want information from the town, where do they go?
There are really two areas that I recommend. The first is to go to the town website. There's a great deal of information on there. And also, in particular, follow the Plymouth Board of Health. The staff at the Board of Health has done an excellent job of keeping everyone in the community updated. And also continue to watch this program. Today is a great example of people coming out with information that is timely and up to date, and you don't have to sift through it. You're getting the truth, and I think that's what's important. I would like to just comment on my takeaway for today, because I think it was an underlying theme with each of the panelists, and that is that to let common sense prevail. Each act of prevention counts. That I'm taking with me for the rest of the day. Thanks, Steve.
Thank you, and that's Kenneth Tavares, Chair of the Plymouth Select Board. Next week, a special presentation on Tuesday, November 24th, due to the holiday on Thursday. We'll be joined by Ken and Matt, and our special guests, Dr. Mark Wilson, Sarah Cloud, Michael Jackman, Michelle Brady, Amy Naples, and our newly elected Senator Susan Moran. Please join us at noon next Tuesday. I'm Steve Triffletti, Plymouth Town Moderator. Thank you also to PAC TV for all of their support. Good day.